On today's episode of Dr. Momcast, we talk to international expert on kids' technology and gaming addiction, Dr. Ed Spector. Ed gives us useful prompts to talk to our kids about digital life.
What's the weirdest thing they're seeing? What's the funniest? What's the cringiest?
We talk about the controversial topic of how much screen time is appropriate for kids. And Ed gives us resources for families navigating the digital world. We are real moms talking about real science and real life.
Hey, everybody. Welcome back to Dr. Momcast. I am Dr. Marla Shapiro here with, most of my favorite sports neuropsychology colleagues, the ones that aren't on vacation.
I'm Dr. Sonia Mosch.
Dr. Alyssa Wicklund.
Dr. Summer Ott.
And we are here with Dr. Ed Spector, who is a nationally recognized expert in digital addiction. Kids' digital health is certainly a topic germane to parents of any ages, kids of any ages interested in health and safety. Since 2009, Dr. Spector has specialized in the treatment of compulsive tech use. His work has been recognized on Good Morning America, Matter of Fact with Soledad O'Brien, NPR, as well as ABC and NBC News. He's a sought-after speaker and presenter focusing on innovative and groundbreaking treatments for addiction and mental health as it relates to digital media. He has been highlighted in numerous articles about digital wellness, including the Washington Post, New York Times, Voice of America, Scholastic Magazine, and Rewire Organization. He resides in Washington, D.C. with his wife, 2 kids, and most curiously, 2 fish tanks. And so, Ed, Dr. Spector, we are so delighted to have you here. We have so many questions. I'll start broadly with this question of what exactly is digital addiction? How did you get into this work? And in the 15 years you've been doing those, your kids have been growing up, what changes have you seen?
I started this all really by accident, just by being who I am. So a male mental health professional who works with teenagers, and I happen to be a gamer. I mean, there really is not a lot of male mental health professionals who are therapists. There are only a few of us to begin with. And then most therapists who are female, they had a client who was playing a lot of games. And at the time, they were pretty violent video games. They just didn't want to deal with it. So I got a lot of referrals from other professionals in the area who were like, hey, I think you'd really connect with this guy. And before I knew it, everyone who was coming to me was a teenage boy or a young adult, and they were all gamers. And I didn't have a choice. Then I just went out on my own. I'm like, all right, this is the thing. I guess this is what I'm doing. At that point, which would have been maybe 2009, the practice formed because of just my interest. I started seeing more and more guys where it was the central problem. They were gaming and dropping out of school. At that time, the average age of my clientele was 19, having failed our freshman year in college. And that was like everybody who saw me. That's how it started. They were all playing one particular game called World of Warcraft, which was what's called an MMORPG, which is a massive multiplayer online role play game. And you just kind of live in the game. People would log in and put it in a 12-hour day. And
wow.
Yeah. And they would,
exclusively male?
Exclusively male. And even now I have 2 female clients, one of whom is not for gaming at all.
Wow.
We are all autistic. Females, also similar age, 19, 20.
Interesting.
Yeah.
So this niche found you is what you're saying.
Yeah. Yeah. In 2009, there was nothing.
Yeah.
Hillary Cash and David Greenfield.
Mm.
David was doing more stuff on porn. And Hillary had Restart in 1991 or 1998 or something like and then everything else was in Asia. And the things that were being done in Asia were scary. They were camps for kids that were militaristic and a lot of abuse, and it was awful. So really there were just crickets. And so I had to create protocols. So I took cognitive behavioral therapy. I took stuff from addictions models, from overeating. And here's the thing that I found in that journey, CBT was really good. Cognitive behavioral therapy had some really good things that you could do. And the addictions model was really challenging because there's no amount of heroin that's the right amount of heroin, right? I mean, just 0 is the only obvious goal. And for vast majority of those models, 0 is the goal. But to tell a teenage boy that the goal is 0, you can never use computers, you can never use a phone, you can never game at all, is really not what we're going for. It's much more like the overeating stuff. It's okay, we need to have a healthy relationship with food. You still have to eat. And so those strategies were some of the best strategies because they dealt with things like cravings and the psychological underpinnings that are making you eat. It was much more fruitful territory. So I created, it was kind of like making up my own stuff and tried stuff out. If you want to get certified in gaming disorder, which is the diagnosis now, there is one program for mental health professionals. And we started it 3 or 4 years ago doing a live webinar, and then we now have made it into video. And I think I'm 9 hours of it. I mean, it's a 15-hour of lecture and 30 hours when you include the self-study. And I think I'm 9 hours because there's still nobody doing this work.
Right.
There's the treatment side. There are people writing books who are researching it. There are people who see 12 people a week, but there's no one who's all in. This is who I am as a therapist, and these are people I'm serving. And you need that to be good at this.
It's so interesting you talk about healthy relationship with it as opposed to, I don't think it's either
Abstinence.
too much.
Yeah.
You also said when you started out, your average patients were 19.
Yeah.
But it sounds to me like that's changed. Yes.
Oh, totally transformed. So everything was on a computer. My guys who were playing World of Warcraft were kind of these loner, very isolated introverts who would never fit in anywhere and had been there a long time. And what happened was phones became devices that were really computers. And so the phones started getting more and more traction in my practice, and the ages got younger and younger. And COVID just blew out the lower age. So now I'm seeing middle schoolers and high schoolers. I'd say my average age is more like 16. And I still have the 20 somethings, but COVID also brought different kids into my practice. For the first time, I had to be up on sports. I literally got a fantasy football league so that I could speak to my guys about who was hot that week, because all of a sudden I had athletes who couldn't be on the sports arena because of COVID. And so they needed to do something competitive. And so they found video games, and they never would have found video games. I am sure that they never would have met me, but we shut down all of their outlets. And so as a result, this is where they came.
How'd you do in your first fantasy league?
Well, I played it like a video game, not like a sports fan, which actually means that I did well. I was always in the middle of the 13 teams that were in our league. I didn't do embarrassingly, right? But I would just look at the stats and treat it like a game. I didn't even know some of the people. I was just looking at their numbers. I learned from my first season. My second season was better, but still about the same.
Your rookie season was kind of rough, huh?
It was rough.
Saying?
Yeah,
it was redshirted onto the team, and they're like, "Oh God, who let this guy on our team?"
It was a little embarrassing.
Why do you think some people turn to this? And at what point is it, I got nothing else to do, so let me be a gamer? To when do you call it digital addiction? What's that threshold?
The only diagnosis we actually have that we can use formally is gaming disorder. They took addiction out because the people who decide this kind of stuff wanted to keep the word addiction to really apply to a substance that enters your blood, crosses the blood-brain barrier, creates tolerance and withdrawal. I just want to be clear, the terminology. We call it just digital addiction, or you're addicted to your phone or whatever.
What if you have a social media addiction?
No, you're not allowed to diagnose that. That's not a
that
thing
doesn't
yet.
exist.
It doesn't. Yeah, it doesn't exist yet. Obviously, my clients come in and they have very significant compulsive behaviors around technology and social media. The 4 most common diagnoses that seem to really propel you into this problem are autism, anxiety, depression, and ADHD. Probably the most common is ADHD. And so which makes sense once you really understand ADHD. So with attention deficit hyperactivity disorder, we have a difficulty controlling the spotlight of our attention. You get stuck on things that are really interesting to you, and then you can't look away. What's more interesting than a video game? It's incredibly neurologically stimulating. People get stuck, and then they look up and it's 4 a.m. and they didn't sleep and they didn't do their homework. And how are they going to go to work tomorrow? Whatever it is that their responsibilities are. And so we're seeing ADHD manifest. And so there's a 40% comorbidity with ADHD and compulsive tech use, which is insanely high.
If you just ignore someone that comes in the room while you're on your socials, then that's not a disorder then, right? You're just asking for a friend. Just checking.
I also wonder too, Ed, do you think that the gaming manufacturers are getting more sophisticated in using cognitive psychology and other things to make their games more, air quote, appealing, AKA addictive?
Well, they all have consultants. All of these environments, whether we're talking about social
How do we get that job? And
Well,
sure
first
it
of all-
pays more than my job.
Yeah, I'm not sure that it does. I mean, all of these environments that we're traveling in, whether it's TikTok, YouTube, a video game community, they've been created by the world's greatest scientists to keep you there watching, playing, participating. They want engagement. They want your eyes, and they're geniuses. I don't care what my training is and how much I know. If I go into one of those environments, I can go down the rabbit hole too. It's like we all can be susceptible to it. Once you respect that, then you can control it. But if you think, oh, I'm going to be able to handle this, it's not a good choice. Part of what the work that I do with my clients is getting them to realistically look at how much control they have when they're in these environments. If we use the eating analogy, I don't go into Dunkin' Donuts ever because I
Right.
can't leave that place without 3 donuts. There's just no way. I could say to myself with a false narrative, I'm just going to get a cup of coffee. You know, they have good coffee. So that's never happened, right? And that's what my clients do.
Yeah, that's why
Every
people
day
go
they're
to
like,
theaters just for the wings.
I'm just going to play one match and then I'm going to go do my homework. So that false narrative is there. Part of what we're doing in the therapy is attacking the false narratives. I can't tell you how many clients I have where they're like, I stay up so late because I don't want to leave the party. All my friends are there and it's 1 a.m. and I don't want to be the first person to leave. And what if something really cool happens? All right, you've been doing this for 5 years. When was the last time something really cool happened after midnight? And they're like, nah, never. It's always really dead because we're all really tired. I'm like, so what are you holding out on? When they do break up, they're like, all right, guys, it's midnight. I just need some sleep. I'm going to pull out. I'm dipping, is what they'll say. I'm dipping out.
I'm dipping out.
I'm
Okay. I
dipping
want to
out.
learn
And
these
then-
terms. Okay.
And
Yeah.
then the guys are like, oh yeah, you're right. We should leave. They're thankful. They're not, it's like, who wants to be the first person to leave the party, right? So you're really dealing with a social dynamic there, much more than like an actual gaming disorder.
Do you really have to convince your patients that this is really a problem, or do they come to you with some recognition of that?
All versions of that. So I get people who are dragged in and they'll start the session with, F you, I don't need to be here. It's my mom's problem. She just doesn't understand what kids do these days. That's one version. Luckily, that's not huge. People come in and they failed some classes or failed out of college or their friendships are in the toilet because they're just not IRL anymore, not in real life with people. I've designed my room. I can't really give you a tour of my office very easily, but I've designed my room so it's an homage to all things video games. So I have guns mounted on my wall that are from the game. They're replicas. They're not real. I have action figures everywhere and I'm wearing gaming t-shirts. People come in and they're like, you're weird. And they're right. So I'm different than any adult they've ever met. And so they come in ready to be angry with me and they forget when they see the office and they're like, wait, isn't this the portal gun? And isn't that the gun from Gears of War? And I'm like, yeah.
Love that.
And then they see my gaming computer and then they engage with me as a gamer. And then we get down to a serious conversation. And then the serious conversation, often I'll be like, have you had any problems with this? Have you a hard time controlling yourself? And they'll often admit to me like, yeah, I did download this app that was supposed to control it, but then I just cave and get through it.
Do you ever play video games with your clients as a way to connect if you're having problems with rapport? Okay.
Huge no-no. At the end of the day, it would be like drinking with an alcoholic. They understand I will talk about games with them, but we're not going to game together because then I can't talk with them. When they game, they're not really available. Now, of course, during COVID, this was a huge problem because I was, of course, seeing everyone online. And so it was kind of like treating alcoholics in a bar. It was really fun.
It's a good example.
Oh my gosh. I never thought how challenging that is when the medium is the root of the problem.
Yeah.
You mentioned earlier gaming disorder.
Yeah.
When we're looking at the next edition of the DSM, do you think we're going to be moving to technology use disorder, how we now have substance use disorder?
It's really interesting the way this played out. The APA, who does the DSM-5, they created a gaming disorder that's called something different. Internet gaming disorder is what they called it. And that was for like further research. Like if you're going to research this, here's the criteria we'd like you to use. And it's because the research is really scattered. What was happening is researchers were defining the problem themselves, coming up with criteria on their own. And so everyone's criteria is a little different. And so this was a way of getting everyone under one banner. It's kind of a conservative approach. Let's at least study this more in a way that's cohesive. And then 2 years later, the World Health Organization decided to skip the line and just penned it. This is gaming disorder. Here's the criteria. We're tired of waiting. And I don't know exactly why they were so quick to it. I don't know what the politics were. It was a huge deal. Whole countries were like, Canada was like, I don't think we're going to really pay attention to that. The whole countries were weighing in with criticism. It may have been that just the problem is so bad in Asia that there was enough there that they felt they had to at least put it in the system. It was a profound shift very quickly. So I don't know what the American Psychiatric Association is going to do because it will be in the ICD. So now it's a matter of how are they going to address it? And the ICD criteria, to be frank, are vague. If you want to confuse 9 million pediatricians all at once, this is a great way to do it. And it's because it's just so big.
Yeah.
It's okay. You need to have a perseverative fascination with gaming for more than 12 months where you over prioritize it. You can't avoid consequences. And it has to involve a clinical impairment in a couple areas, which was everybody during COVID. So that didn't really mean anything. It doesn't say anything about, are we talking about an 8-year-old? Or are we talking about, is this the same for the criteria for a 19-year-old? This hasn't been fleshed out yet, but it's
Right.
better
What
than
about an
nothing.
esports athlete
Right.
who that's what they have to do is do sports as a game for
Right.
how many hours a day? Where do they fit in?
Right. It really doesn't speak to a lot of things yet. It's a really very much a first draft.
I think that's a great point too, Alyssa. We're talking about extremes such that we're going to give it a label or give it a pill, go to treatment. But I think that most people worry about the stuff that's in between. They won't get off the phone. They won't get off the computer. Do they know how to talk to each other anymore?
Yeah. One of the biggest things that I care about when I'm working with families is that there has to be this ongoing dialogue, and it is the most important and really the only thing. It used to be one slide of my presentations, and it became, for one organization, it became the topic. Let's do a whole topic just on creating the ongoing dialogue about technology. What do you talk about when your kid's 8? How about 10, when they're 15? How does that grow, and how do you do that in a way that's not preachy and not judgmental and doesn't shut down the conversation? Because as parents, you are both trying to have this very important relationship with this person where they trust you, where they'll come to you, they'll tell you what's going on. But at the same time, you're also kind of a police officer. You have to also, what did you just text? Are you being safe? Are you being responsible? And so the balancing act, which is nearly impossible to manage, is how do you maintain an ongoing dialogue, particularly where they're 15, they've sent a risky picture and it got shared. You need that person, that teenager, to be comfortable talking to you. And the only way they're going to be comfortable is if you've had a million conversations with them already about it. Delaney Rustin, who did Screenagers, and she and I shared a podium a bunch of times where they show her movie and then there's a panel discussion. So I've been on that panel. And so I've gotten to know her, and she has this thing called a Tuesday Tech Talk. Really an awesome idea. Now, in my family, it wouldn't work every Tuesday. There's no way I could weekly do this. It'd be brutal. Also, this is all I do for a living, right? The Tuesday Tech Talk, the premise is as early as you're willing to do this with kids, you start finding out what's in their online world. What are they doing? What are they experiencing? What's the weirdest thing they're seeing? What's the funniest? What's the cringiest? You're getting them talking, and that's all. You're just getting them talking. And when TikTok comes out, you're like, what the heck is that? Let's do TikToks. So the dialogue is really what's important, because you don't want to create a parental vacuum where you aren't. And they're forming their identities around what they're doing online. It is very important to them.
I think on one hand, we don't appreciate what ought to be our new normal, but I also think that many of us recognize the positives from the time spent in online games, especially when it involves people at the other end of a controller. What are some of the positives that you see from gaming, besides the fact that you personally like it?
When we survey people and ask them, what are the good things? There's a long list, some of which is healthy and some of which is not. So people like feelings of mastery. They like feeling like they matter. They like being tied to a team. They like forming friendships in this way, doing activities together. They like the competitiveness. These are complex intellectual puzzles, and there's a million different kinds, so that for every person, there's a game that really is just what you're into. So I'm into fish tanks. There are lots of games where you are in with the fishes swimming. There's totally great games
Now
where
we
you're
got our
like
answer. Now we know what fish tanks are.
trapped on a desert island, and you have to survive, and you have to go fishing, and you have to get resources. But if you like trains, there's a million different games you can play about trains, how to manage trains, run your train, operate a train, how to design a train.
I feel like the shooting games are most heavily advertised. I don't see the advertisements for the fish tanks.
Correct, because those are lesser known games. So the AAA titles are what you're talking about, which is the Call of Duty, it's the Valorant. Those games are 1,000 people working 5 or 6 years to create a game. Versus there are all these games made by 2 guys in someone's garage, and there's everything in between that.
When you brought up, what did you say, Ed? AAA
Yeah.
games? Is that what you called it?
Yep.
What does that mean? Like the big league?
Those are the games that cost $500 million to make and are released and make more than a major motion picture. They make $1 billion.
Oh my goodness.
No, these are big games, and they
That
risk a
is
lot.
incredible.
Sometimes they flop, so sometimes they don't get their money's worth.
And are these games like the NHL games where you assume the character of a specific player, are those also considered AAA?
I think so. If you had a panel of 5 gamers, we might start arguing about
Okay.
what really,
Okay.
how,
Uh-huh.
because, but they're all the major sport, like Madden
Mm-hmm.
as a major
Mm-hmm.
franchise, FIFA, the sports games
Mm-hmm.
are out there. And I would consider them because they're so mainstream, they're mass appeal.
One of the things that I think is interesting is the fantasy aspect. As psychologists, we try to understand, why do people do things? What is the impulse that drives you to engage and assume the character?
Mhm. When people come in and I'm evaluating what's going on with them, we have to discuss what games are really getting under their skin. What are the games that they can't control themselves around? And then we explore why. And the games that they like often really speak to the needs that are being met. The reason why you need to be a gamer to do this work well is you need to know what ticks with each game. So someone says to me they play these 4 games, and I'm like, oh, that's interesting because all 4 of them are online games where you have to play with other people. And there's a certain dynamic that's going on. Games are really a personality test. So what does this say about your personality that you went to these games? You had a million games you could have played. Now, sometimes the answer is, this is the games that my friends play. And sometimes there really is some underlying need, and it might be a healthy need, or it might be an unhealthy need, or speak to something that's not working in their real lives that then they're getting elsewhere. So, they're not being successful
Interesting.
like in certain domains, but they can be successful at video games. So they are. And it could be they have a learning disability and school is really hard. It could be that they have really poor executive functioning skills, and these games often really require none. And so they can really excel in these worlds where they can't figure out how to not get lost in their own basement on their own in their real lives. So you can see why they would gravitate to it. We create a functional understanding of how this fits in with them, including, do they have ADHD or autism or anxiety, depression? Because all of those things lead very differently into this problem. If you're anxious or depressed, what you're doing most likely in gaming is doing something that's incredibly immersive and dissociative. When you are gaming, you are not thinking about anything but how to get to the next room and shoot the sniper or whatever. As a result, you're getting an escape from your depression and your anxious thoughts. And so you're doing it as a more escapist route. But if you have ADHD, that has nothing to do with why you're there. You're there because you got stuck on it and you're avoiding your homework, right? And you're not able to move the spotlight from the game to the homework. If you have autism, completely different set of issues, right? So that all plays in.
Is there such a thing as shifting them to other games that are more therapeutically beneficial or might facilitate self-control as kind of a gradual exit versus an either or?
No, we're often strategizing about, so that game tilts you. Here's another word, tilt, gets you really angry, right? And makes you rage quit. That's another. But I don't know, this podcast is probably going to outlast these terms. If I have a client who comes in and he plays Siege, which is a military game where you play in teams, and he's not very good at it. And it's really frustrating because he's playing with his friends and he's not doing well. And they get mad at him because he lost the match because he did something wrong. And so as a result, he screams and breaks his controller and scares his younger siblings. We're like, all right, so maybe this game's not a good game for you. Let's figure out either what can we change about the situation so you don't freak out like that, or if you don't have that kind of cognitive flexibility where you can think about it differently, then what games do we do instead that are more casual, that don't have such an intense dynamic for you? We're trying to massage that in one direction or the other to get a better outcome.
I have witnessed the breaking of the controller. And as a parent, my inclination is no more games. But you make such a good point. Why are you throwing the controller?
Yeah.
What is that eliciting in you? And right there, I'm cutting off the communication. But
Right.
instead, why is this happening? And how can you get the positives out of it, but you don't have the rage quit? Is
Right.
that it?
Rage quit.
Rage
Yeah.
quits. Yes. I'm going to impress my teenagers.
Right.
Rage quit.
Right.
That's such an important point.
Right. And if you approach those kind of moments more with exploration when
I
they've
love
calmed
that.
down, which is sort of like, whoa, that looked really rough.
Yeah.
What happened? Help me understand. How can we help you with this situation? Sometimes you find out it's actually a social problem.
Oh.
So here's the thing. Right now, games are primarily online with other friends. And so you're dealing with all kinds of complicated social situations. So if you have a kid who is in a social situation and doesn't yet have enough social skills to handle that situation, you're not actually dealing with an addiction issue or an emotional regulation issue per se, so much as, okay, you're not old enough to be traveling in these waters, but you're in a situation where you don't understand how to navigate it. In video game scenarios, it's often 5v5 or 6v5. You have two teams of 6 people or 5 people. And so you're a part of a team. If you leave suddenly, if you quit, the game ends for 11 people. Like you might be banned, you might be banned. And the other thing that's really that they're dealing with is the match might take a half an hour. It could take 45 minutes, or you could all lose in 5 minutes. Mom might think that they gave you plenty of notice. Hey man, we're having dinner at 6:30, but is that kid doing the math? Okay. So the last match I could possibly start is at 5 o'clock to go to dinner at 6. They're not doing that because they're 13. And then they're in the situation that they cannot leave socially. But the parents are like, dinner's on the table, get your tush down here. And then the parents often don't understand the social situation that they're in. If they were in the middle of a basketball game for real, the parent would understand, right? Because they know, oh, he's playing basketball. Look, he's doing really well. Let's just delay dinner. It would be different.
Right.
But because they're upstairs with headphones on, we don't know as parents.
I think about kids are online, ergo their social skill development is being stunted, but it's really not true because there's a different kind of social skills and belongingness that is developed through online gaming from what you're saying.
It is a part of now the landscape of social skills. They have to be good at both. And COVID put us in one direction all the time. And so now we're having to catch up with how do you be social IRL in real life? But yeah, they need both.
Especially now that it's summer and my kids are out of school. I'm wondering what's a healthy balance between too much screen time. What do you advise parents on that?
I feel like with the issue of how much, it's really nuanced, right? So you have the kid and how vulnerable they are. And that vulnerability is related to age and the worlds they're trying to hang out in. So there's a match issue of, is my kid old enough for TikTok or not? Is my kid old enough for Instagram or not? And as a parent, have to know the seedy sides of all of these places before you let your kid have it, ideally. So that means parents are stuck researching whatever worlds the kid wants to go to. So one is to make sure that there isn't a mismatch in terms of the level of maturity or emotional regulation that the kid needs to have. You've got to know your kid. If your kid's really impulsive and makes bad judgments and you're going to connect them to 9 million other people without a filter, you got to be a little careful about that. If you have a kid who's very cautious, responsible, and has some track record that makes you feel like they can handle it, then you might, even younger than the age recommendations, you might throw them into a social media site that maybe you wouldn't the other kid. So know your kid is really important. That ongoing dialogue helps you understand whether or not you get a sense of what they're doing. They start sharing with you. Now, in terms of places like YouTube, I mean, one of the things that all parents are generally good at understanding is opportunity cost. It's what you would have done with those 2 hours had you not been using YouTube. Now, there's some value to YouTube. Kids learn all kinds of interesting things, and they often are seeing a variety of content, not just silly. And so you don't want to totally crush that. But if you're having that dialogue and it's going well, then there's an understanding of your values and how much is too much based on what other opportunities are out there. If you could watch 2 hours a day for the summer, or you might even do more. I mean, there's one article in the Washington Post when Fortnite came out. It was called The Summer of No Sunscreen. And
Awesome.
that's the opportunity cost, right?
Apocalypse,
Right.
people.
But it's not. I mean, the thing is, we don't want to scare people. It's not that. They have to learn. They're going to have to learn how to live in moderation around this stuff. When they're on the younger side, they really need our guidance. So we have to be very present, and we have to be teaching them and modeling, and we need to be participating. I got in a lot of trouble on Soledad O'Brien because I was like, you should be playing Fortnite with your kids. At the time, her twins were 13, and this was the first video game she had entered into her household. And they were loving it. And she could tell it was a phenomenon that was happening. There were hundreds of millions of people now playing it. And so she wanted to do a piece on it. So I was sandwiched in between the Russia investigation and all these serious things. And then I had a 3-minute piece on a video game. And what I said was, this is a very approachable game that almost anyone can play. It's very cartoony. Parents could actually sit down and have a good time playing. And then the key is, though, you can't just participate, whether it's TikTok or whatever. You have to actually have the dialogue, because the dialogue is where you raise and teach your values to your kid about that. Those are difficult conversations to have. You need to have enough history so you can start inputting.
I'm so glad you said that, because some of these things for people with younger children, Ryan's world was huge. This boy got to play with toys all day and rate them, and he's a bazillionaire now. And so
Right.
my son, I could see the wheels turning. He thought, okay, every time I go to the store, I get a toy and then I get to play with it and then I can discard it. And this is not realistic. So I'm glad you said that. I feel like I'm winning a little bit as a parent now for having the conversation. Starting to really burst his bubble, but it's just not realistic.
Take that example. If you're sharing YouTube videos with your kid, which is awesome, right? That's a moment where you're now going back and forth. You're sharing, I share TikToks with my kids all the time. And now you're having an ongoing dialogue, and then you can talk about it. What was your reaction to that? What was my concern? Why would this never work in real life? And you can gently ease it in, ideally. And that can go so much better than if you just get
Go watch that.
annoyed at what is that craft that you're watching? No one can live like that. If you just do that and like storm away, you lost a window.
Right. I'm so glad you said that. That's some useful information. And I might be guilty of that's ridiculous.
I'm guilty of it. I mean,
Yeah.
I need to follow my advice too.
Yeah.
It's hard to be 100% on that. You just have to be successful like 80% of the time at it, and you got a good thing going.
Yeah.
You don't have to go at 100% at this.
What are some of the other prompts to get the conversation going?
So let's say you find your kid watching a media that you object to.
Okay.
They're playing a game or they're watching a stream or an influencer who you really disagree with. Flies in the face of your values. And so how do you approach that? One is to really not be judgmental. Be like, oh, so you're watching that. Tell me a little bit about what the deal is with this person. Are they serious? Why are they making this video? Who's their audience? Who are they speaking to? And what kind of impact do you think they're having? You're exploring and asking good questions. What kind of problems would someone have with this? Do you have any problems with some of the things that this person is saying or doing? Does this make you uncomfortable at all? I encountered this with Call of Duty Modern Warfare 2. Because that came out a million years ago. Ancient game, but there was an airport level that was freaking out my 19-year-olds, where they were like, no, you don't play that level. That's a terrible level. That's just creepy. My neighbor was a 19-year-old, and I'm like, are you playing this game Call of Duty? And he's like, yeah. And I was like, can I watch you play? And I just asked him like to marry me. I could not have been more cool at that point. He played for me, and I put the headphones on so I could hear what was going on. I need to know about the airport level. And he's like, you know about that? And I was like, yeah, what is going on with the airport? What is this? Right. And so it's a level where you're playing a mission. You enter an airport. You are a militaristic faction of some sort. You have guns up the wazoo. You're like dressed in all black and camo or whatever. And you're walking into a civilian airport and you just kill everybody in you. There's no resistance. No one's shooting you. You just murder everyone. And so it was like a line that they had crossed. I can imagine the conversation that needed to be had at the dinner table. Why did they make this? Who's the audience? And you can have really powerful conversations where you're like, I'm really concerned because there's no purpose to this. There's no cleverness to it. The game has some really difficult parts where you're trying to strategically work together to do something, but this makes no sense. It's mindless.
Wow.
Those are the kind of conversations you could have, whether it's your kids watching someone you don't like and you don't like their messaging, you can weigh in. Again, it only happens if you're at the table, if you're having those conversations.
What does it mean to somebody who is very involved in gaming and spends a lot of their time doing that if somebody watches them play? When I played sports, I loved when people came and watched me play. So I think that's a kind of a parallel, right? I'm thinking it means a lot to somebody who's involved in that to have a spectator. Is that accurate, or what do you think?
Well, absolutely. Because if you do something and you do it really well and you're really proud of it and you spent dozens of hours mastering this so you can do it. If you're on the football field, you get immediate response from the world. Like if a musician, you get on stage, people clap. There's a venue for you, IRL. But my gamer guys, they don't have a venue. They're online and their notoriety stays online. People will recognize them in the online communities, particularly if they're really good. They'll win a tournament, or they'll be asked to play for a different team. And those are amazing moments. What's interesting about it is that the self-esteem that's built online, my experience with my guys, does not transport to IRL. So they feel terrible about themselves in real life.
Is it because nobody recognizes it, you think?
Yeah, well, I mean, it doesn't transport. But at the end of the day, yeah, I'm first in the world as a tank on this game. And even I've had guys who've won championships that have made them a lot of money. Yeah, but I can't get a girl to talk to me, or
Mm,
like I failed algebra. I mean,
So
it,
insightful.
it's so
Interesting.
the disparity between their lives. If it's really, really severe, it can be really devastating.
Not only are they not recognized, but then there's also a negative connotation, or they may feel judged by their peers.
But I feel like it's changing. Like it used to
Okay,
be that a
that makes
gamer
sense. That would make sense.
was like a loser. Like those were like my World of Warcraft guys would not tell people what they were doing.
Oh,
But I feel like now there's like people like Ninja, they're celebrities
that
mhm.
makes
who
sense.
are millionaires. I think it's shifted. I think it's less of a negative connotation.
Is that a good thing in your opinion? Why
I
is
don't
that?
know. I mean, I think the disparity often is that's sad to me is more that, okay, so I've had kids who are professional gamers
Hmm.
who were being flown around the world to play championships, and their parents had never watched them play a game, not
Oh,
once.
interesting.
That's what I've
So
Mm.
it's sort of like, this is who I am. This is the soul of my personality. This is what I'm all about. And there's a vacuum there. Yeah, but do your homework. Like it's total disconnect.
Yeah.
So you're not connecting with your kid at the place where they feel the most sacred, right? And
Mm.
that to me is just a real tragedy, because if they picked a different venue and were really good, if they were good at some other thing that was more understandable to the parent, then the parent would be bragging about them. They'd be like getting them a coach, or let's get you a better teacher. Let's put that on your resume.
I've never thought about it that way.
I'm with you, Marlitz.
I feel like
This
people
is-
watch for a couple of reasons. One, they watch to learn how to play the game.
Mm.
Too. So the people who are viewing it are
Mhm.
often trying to learn the game, or they want to see amazing things happen that they can't do, in the same way that I watch a basketball game or a tennis match, because it's like I'm honored that we are the same species, but we are so sort of like, wow, I can't believe we're both human and you can do that. And I
Yeah.
certainly cannot. Right.
Uh-huh.
And so I think there's some of that too,
Mm-hmm. I'm realizing as we're all seated in front of our screens, having this really lively conversation, but sitting is the new smoking. And is there a physiological consequence of an activity that is so all consuming, sedentary?
Yeah, I mean, the opportunity cost is always there. And you can get tendonitis, you can get carpal tunnel, but also you're sitting there for hours and hours, not outside, not in the physical world. And so you're not developing the way that ideally we would develop. You're not getting sun exposure. You're also not getting social interaction. You're not learning how to get through the awkward period and talk to people and be comfortable in your own skin in person with them when there's nothing to do. There's a million things you're not learning. The argument I always make with people, especially when they're doing hours and hours a day, is it's the opportunity cost that is the most consequential. So it's what you would have done and all the things you would have learned. And the thing is, we need our kids to be doing, and people need to be doing, a diverse set of interests and hobbies.
Yeah.
Because every single thing you do has a different set of coping strategies necessary. So what you walk away from is another tool in the toolbox. So by the time you get to adulthood, if you've done a lot of interesting things, you kind of have superpowers. This kind of reminds me of what I had to do to master that. And you have tools and strategies. If you only do one thing, and it could be video games, but it also could be just playing the violin for 7 hours a day, you have foregone learning other strategies, and that puts you at a disadvantage. So apart from the cultural piece that people would treat you different if you play violin for 7 hours versus Call of Duty, like there's a bigger issue, which is you're not making yourself into a diverse creature.
Are longer outcome studies, are there higher rates of like diabetes or obesity or cardiovascular risk factors affecting them?
I think that stuff is playing out in the research, both the obesity,
Okay.
the sleep, and also other physical ailments too, including vision. There's this big shift in vision. All of that stuff plays out, right? Both the opportunity cost, but also there are lasting consequences to it. The eyesight thing, it seemed to be more related to exposure to outside light. That it wasn't the blue light per se that seemed to be associated, but more that they weren't outside getting dopamine from being outside with sun exposure.
One question I wanted to ask, and it's a little aside from gaming, has to do more with social media and especially some of the ugly stuff.
Yeah.
Can you talk to any of that?
Some of it I can. Certainly, the research is pretty clear that exposure to social media is a great recipe for making yourself unhappy. There's this great Teddy Roosevelt line, which is comparison is the thief of joy. And social media is primarily an act of comparison. and it's made to do that. And it happens in conscious and unconscious ways as you're on there. You're like, oh, we didn't go on vacation. And we're like, oh, how come they did that? And of course, it creates this belief, which is false, that we should all be happy all the time, which is totally not true. That's totally false. What we should seek is satisfaction. And that satisfaction might mean being unhappy.
You mean we can't do all the DIYs out there?
Exactly. You can't, but you could try. So it definitely has a very negative impact in the same way that any media, including gaming, is going to have, especially if what you're watching is depictions that are very evocative or violent, or where conflict is always managed in one way, or women are treated really poorly. That is going to impact you. Some people more than others, including like empathy and learning empathy and understanding. I mean, we can't even get started on adult content that kids are seeing now, average age 12.
Average
Right.
age of
First porn use is 12.
Holy cow.
I was just on a panel discussion with Common Sense Media. They had done all this research on porn. It was me and then 4 experts, and we talked very explicitly. It was probably the cringiest think talk I've ever done, but it was really important.
Is that available online?
Yeah, it's out there.
Oh.
Common Sense Media.
Common Sense Media.
Yeah. Common Sense Media is great. If you want to know a particular game, a particular TV show, a particular movie, they have lots of content information about it, what kids think, what adults think, what the right ages are.
Other good resources or sites that you recommend too?
Children and Screens is a great organization. They have talks every week on YouTube. And I've done a couple of those, practical advice about gaming or social media. They're an hour and a half and you've covered the topic, and they're fascinating.
Do you see a way our educational system could help?
There definitely are ways, and we're all in the soup together. The teachers, the school systems are trying to teach your kid, and everyone has phones. And the parents don't want you to necessarily get rid of the phones. Some of them really want those phones on the kid at all times in case there's a shooting, in case there's an emergency. Are you okay? Where are you in the building? We have this very complicated scenario where you're not going to make everyone happy, but organizations as well as individual groups of parents and parents individually need to sort this out in their various communities, because different communities are going to have very different approaches and values. So we can't just say there's one way. One thing I'll say is there is no software or hardware out there existing right now that a motivated 12-year-old can't get around. When you ask for a tool, it's not going to be software or hardware. It's going to be either the community, the values, what's taught to the kids. It's the modeling, how the organizations deal with it. Recently, there was an article in the Washington Post. There were major districts in all different states that have in some way or other completely clamped down on no cell phones until after 8th grade, or no cell phones in our high school. And it described how those communities reacted. It's really complicated. So there isn't like a simple tool, but we talked about, we have ongoing dialogue, participating, but with the dialogue. We haven't really talked about it, but monitoring and at times limit setting around it and how you do that, Richard, which is a much deeper discussion. And how do you participate, but police, but also have the ongoing dialogue? And part of that is really picking only the most egregious things to really be absolutist about, and then other things to really lean in on conversations and find out where kids are. If they really understand why you're forbidding something or really upset about it, if they understand and they feel like they were given a place to talk about it, at least, they're much more likely to comply with your expectations.
That's like parenting, you know?
Right.
Thinking back about some of the things you've brought up. One of the biggest takeaways for me is talking to our kids and not waiting until it's a problem, but also doing so regularly. What are you doing? Or let me do it with you. Another takeaway is joining our kids and not making it an us versus them, but something to be shared. Appreciate that there are skills and strengths that are developed and emphasized in their game playing. But like everything else, moderation. I forget the language you used, but what are they missing out on?
Opportunity cost. I have so much from you, Ed. Thank you.
It's been really fun.
Right.
Really fun. I've been
So helpful.
Anything else anybody else wants to say, or do we want to limit our screen time for the night and go do s'mores, bed, sleep, rest our voices, whatever else it is we do?
Well, let's model self-control, even though we all want to talk to Ed for another hour. I mean, isn't that a good lesson that we're teaching the listeners?
Yeah, no, it's because I
absolutely.
want to go have s'mores.
I really want to get on my socials.
Like when I didn't know s'mores were involved. When did that that's awesome.
Come on over, man.
Yes.
Like,
Well, I feel like
Thank you
Dawn.
so
Thanks,
much
Ed.
for your
This has been
time, Ed. It was
fantastic.
great to meet you.
nice meeting you. Good night, all.
We have so much more to talk about.
There's
I
so
feel
much more we can talk about.
like a more of like a sense of humanity
Yeah.
of how our
Yeah.
kids are just little humans trying to navigate life with these screens and develop their sense of competence in different parts of their life.
Totally. But it's like everything else parenting, it's everything in moderation. What unique skill or attribute is this fleshing out or developing or highlighting for you?
Trying to connect with you.
And I blew it, man. So I am going to go
Me too.
apologize, but ask, why did you want me to see that? What is appeal? And not, well, I do ask her that, but I'll ask her far less sarcastically. But what was appealing and why did you like that? And I feel really bad because she wanted to share it to me and I just smashed it, man.
So now you're going to watch my reels?
Maybe.
She's trying to connect with you, Marla. Watch her reels.
I told her today I made a reel and she's, oh, I guess I missed that.
Sometimes the kids want to show me something I'm like, I am not interested in that at all. And it got me thinking, how many fill in the blank games have I sat through? 6-year-old baseball is like watching paint dry. And I will sit through that painfully.
He said acceptable venue, I love that term,
Yes.
acceptable, like it's the typical venue.
Yep.
Yes. Whereas I could also just sit and not enjoy the content, but connect for 10 minutes on some stupid video because I spent an hour and a half watching paint dry and thinking that I was doing the good thing because I'm just physically there. And really, they want us physically there in our digital world. I think they might be asking us, and we're not picking up what they're putting down.
No,
We
we
need
do
to-
more TikToks with our kids too.
I know my daughter does not want to be a TikTok with me. But so when I married the husband and he had teenage kids.
Yeah. Are you saying husband?
My ex-husband is
He's a has-been kind of thing?
Yes. No, he's my ex. He's my
That's the term for tonight. Was been.
Husband.
I
Marla,
can't
damn
take
it.
credit.
Every time I learn some new husband. Okay.
husband.
We
My
also
was
learned rage quit and
Tilt.
what else?
tell.
Tilt.
Well, I can't take credit for it, but my husband had teenage boys. I'm like, let's forget Guitar Hero because it was a way to connect with them. And so when I talk to my clients or kids about having conflicts with parents, and I'll say, what do you guys do routinely together? Do you ever have family game night? Do your parents ever do video games with you? And they all laugh. And I think we're all guilty of that. But for parents not to indulge their kids' desires, I think we think of gaming as bad or negative.
Yes.
And I'm so glad that he really showed me a whole new perspective, at least.
Absolutely.
It's part of their world, like it or not.
Yeah.
And that is a great ending.
See y'all next time on Dr. Bombcast.